Hello everyone, it's your friendly doctor here, and today we need to talk about something that's back in the headlines: coronavirus. You might have noticed reports about COVID-19 making a comeback. Is it really happening? Let's break down what's going on. The coronavirus, officially known as SARS-CoV-2, spreads mainly through respiratory droplets when people cough or sneeze, especially in crowded or indoor spaces. It's a microscopic virus, far too small to see without specialized equipment, but it can cause symptoms similar to a cold or the flu and sometimes more severe illness. SARS-CoV-2 is a type of coronavirus, a group of viruses that have been studied for decades. The virus attaches to cells in our respiratory system, enters them, and then replicates, leading to infection. As it multiplies, it can trigger symptoms ranging from mild to severe, depending on the person and the variant. This is how most viruses operate, whether they cause a simple cold or something more serious like COVID-19. The illness caused by this virus is called COVID-19. You've probably heard a lot about it over the past few years. COVID-19 is part of a larger family of viruses, many of which have been around for a long time and are known to cause respiratory illnesses, including the common cold. So why is COVID-19 making headlines again in June 2025? The reality is the virus hasn't disappeared. Like many viruses, COVID-19 continues to evolve. These ongoing mutations are a normal part of how viruses survive and adapt. Most of these changes are minor and don't significantly impact our daily lives. Occasionally, though, a new variant emerges that spreads more efficiently among people. When that happens, we tend to see a rise in cases, which brings COVID-19 back into public discussion. It's not a cause for alarm, but it is important to stay informed and aware of the situation. The positive news is that we're far better equipped now than we were at the start of the pandemic. Our immune systems have adapted and we have more tools to manage the virus. Think of your immune system as a highly trained defense team ready to respond. Vaccines and previous infections have helped strengthen our collective immunity. This means our bodies can recognize and fight the virus more efficiently than before. As a result, for most people, COVID-19 is now a much milder illness compared to the early days of the pandemic. Let's take a closer look at how the coronavirus changes over time. You may have heard that the virus is constantly evolving. This happens through a process called mutation. Mutations are small changes in the virus's genetic material, or RNA. When the virus replicates, errors can occur, leading to these mutations. If a group of mutations gives the virus an advantage, like spreading more easily, it can become more common. We call these new versions variants. Each variant is defined by a unique combination of mutations, especially in the spike protein, which the virus uses to enter human cells. Some mutations can make the virus more transmissible, allowing it to spread more efficiently from person to person. Over the past few years, you've probably heard about variants like Alpha, Delta, and Omicron. Each of these had distinct mutations that affected how the virus behaved. In 2025, we're seeing new subvariants of Omicron, such as JN.1. This variant has accumulated additional mutations compared to earlier forms. These new mutations, particularly in the spike protein, can help the virus partially evade the immune response, making it easier for the virus to infect people who have some immunity from vaccination or previous infection. That's why variants like JN.1 are becoming more common in different parts of the world. But a new variant doesn't automatically mean it's more dangerous. Most changes make the virus better at spreading, but not necessarily more severe. So far, variants like JN.1 haven't caused more severe illness than previous versions. Our immune systems, especially after vaccination or past infection, still recognize key parts of the virus and can mount a defense, even if the virus has changed slightly. This means that while you might get mild symptoms, your body is usually able to prevent serious illness, particularly if you're otherwise healthy. Viral evolution is a normal process. The virus accumulates mutations to adapt, and our immune systems adapt in response. That's why scientists and doctors globally monitor these changes, tracking new variants and ensuring that vaccines and treatments remain effective. This ongoing surveillance helps us respond quickly to any significant changes, keeping us prepared for what's next. Let's take a closer look at how the latest COVID-19 variants are impacting different regions globally. As of mid-2025, much of the recent attention is focused on Southeast Asia, where increased travel and social gatherings during the summer months have contributed to a rise in cases. Countries such as Singapore and Thailand have reported a significant uptick in positive COVID-19 tests. In Singapore, weekly case numbers have climbed, and in Thailand, the number of reported cases doubled within a short span in May. While these trends may seem concerning, it's important to put them in context to understand their real-world impact. A rise in cases does not signal a return to the crisis levels of 2020. Most people who contract the virus now experience mild symptoms, similar to a common cold or seasonal flu. Typical symptoms include a sore throat, cough, or fever, and most individuals recover at home without requiring hospitalization. This is a stark contrast to the early days of the pandemic. Widespread immunity, built through vaccinations and previous infections, continues to provide strong protection. But what about hospital capacity? Are hospitals under pressure again? The answer is no. While places like Singapore have seen a slight increase in hospital admissions, healthcare systems remain stable and are managing the situation effectively. Medical staff are able to provide care without being overwhelmed. In Vietnam's Ho Chi Minh City, where cases also rose, officials noted that most hospitalized patients had only mild symptoms. The minority who became seriously ill were typically older adults or those with pre-existing health conditions, making them more susceptible to complications. This highlights the ongoing need to protect vulnerable populations. Overall, the current pattern is reassuring. The virus is spreading more efficiently, but it is not causing more severe illness for the general population. In India, for example, authorities report that the situation is well under control, with very few active cases nationwide. Globally, the situation is varied. Some regions experience temporary surges, while others remain relatively unaffected. This reflects a new reality. COVID-19 is now a manageable part of daily life, rather than a force that dictates how we live. We have moved beyond the emergency phase and are now in a period of ongoing informed management. With COVID-19 still present in our communities, how can we make smart choices to protect ourselves and those around us? The most effective strategies are straightforward, practical, and likely already part of your routine. These aren't extreme measures, just smart habits that help reduce the spread of all kinds of viruses, including COVID-19. It's about being responsible and considerate, especially in shared spaces. There's no need for panic or drastic changes, just a few reliable habits to keep you and your community safer. Here's what you can do, step by step. First, prioritize hand hygiene. Wash your hands with soap and water for at least 20 seconds, about the time it takes to sing happy birthday twice. This is one of the simplest ways to remove germs. If you're on the go and can't access a sink, use hand sanitizer with at least 60% alcohol. If you're feeling sick, whether it's a cough, fever, or sore throat, stay home and rest. This not only helps you recover, but also prevents spreading illness to friends, classmates, or co-workers. Pay attention to ventilation in indoor spaces. COVID-19 spreads through tiny droplets in the air, so improving airflow indoors is key. What does that look like? Open windows or doors whenever possible to let in fresh air. In crowded indoor settings, good ventilation helps disperse virus particles, lowering your risk of exposure. Whether you're at work, in class, or commuting, making sure there's fresh air is a simple way to make shared spaces safer. Vaccination remains one of the most effective ways to protect yourself and others. COVID-19 vaccines and boosters have played a major role in reducing severe illness and hospitalizations. Vaccines train your immune system to recognize and fight the virus, lowering your risk of serious complications. Stay updated on booster recommendations, especially as new variants emerge. If you're unsure about vaccines or boosters, talk to your healthcare provider for advice tailored to your situation. They can help you make informed decisions based on your health needs. By following these practical steps, you can confidently navigate the new normal, staying healthy, informed, and ready for whatever comes next.